Hello, we'll be talking about your hemodynamic monitors. So when you talk about hemodynamic monitors, basically these are your monitors in the clinical setting that is able to monitor the hemodynamic status of your patient. And when I say hemodynamic status of your patient, it usually pertains to the functioning of your patient and the attainment of equilibrium. In other words, class, the state of balance. Okay, the state of balance. So for example, in the hospital, if I will say that my patient is hemodynamically stable, that would mean, class, that my patient is recuperating. Okay, in other words, nagpapagaling na siya. Or it also means, class, that my patient's condition is good in such a way that it allows optimal functioning. So one of the reasons why we are doing your hemodynamic monitoring is for us to determine whether our patient has a condition that needs immediate attention or whether our patient's class condition is deteriorating or not. Now, let's see some examples of this or some applications. So class, your technology allows us to measure hemodynamic parameters closely. Okay? It closely examines your cardiovascular function. As is with our previous discussion, class, as you can see here, when I talk, diba, about your cardiovascular function, class, give me the two vital signs that pertain directly to your cardiovascular function. Give me the two vital signs that pertain directly to your cardiovascular function. What are those two vital signs? Anybody? Yes, you have your heart rate and then you have your blood pressure. Okay, if we will go deeper, yes, your temperature and your respiratory rate is also connected to your cardiovascular function. However, class, directly connected to your cardiovascular function is your heart rate and your blood pressure. If you would look at, class, your cardiac monitor that I have previously discussed to you, your cardiac monitor, my dear students, will be able to monitor your heart rate, your blood pressure, your temperature, and even your respiratory rate. What you can see on screen is another monitor, class, that focuses on cardiovascular function. Okay, so class, this is also a cardiac monitor, but one particular input here that was not discussed in the previous monitors is your cardiac output. Okay, class, your cardiac output. If you can recall, dear students, in your lessons in fundamentals and then health assessment, there are two terms that we are usually differentiating. One, class, is your stroke volume, and then another one is your cardiac output. Class, when I talk about your stroke volume, dear future nurses, is the amount of blood ejected by the heart. Okay, move ka muna. By the heart in every contraction. Okay? So ibig sabihin, class, every time that the heart, class, would pump, okay, the blood that goes out is referred to as your stroke volume. Now, when I talk about your cardiac output is also the amount of blood ejected by the heart in every minute, in an entire minute. Okay? So class, stroke volume, bawat pump. Pag sinabi ko namang cardiac output, for the entire minute po siya. Pag sinabi ko pong cardiac output of an adult patient, the cardiac output of an adult patient is playing at 5 to 6 liters per minute. Ibig sabihin, class, normally, your heart will be able to eject 5 to 6 liters of blood per minute. Okay? Now, ano naman pong implication if ever bababa po yung cardiac output natin? Plus, if your cardiac output is low, it could be that your heart functioning is also decreasing. What could be the possible reason for that? Meron po tayong tinatawag na heart failure. Meron din po tayong tinatawag na cardiovascular collapse. And many other conditions that could also affect your heart. So, kung ikaw ang nurse na nagbabantay ng ganitong uri ng monitor, guys, bantayan mo yung cardiac output because if your cardiac output is decreasing, your patient's condition is also deteriorating. Now, pag bababa yung cardiac output, how would I counter-check as a nurse? For example, pag-check ko ng monitor, lumabas sa monitor cardiac output is only 3 liters. And we know just now that is low. What are the other signs and symptoms that I would check to ensure that this is congruent with the decreased cardiac output? What do you think, guys? Pag decrease ang cardiac output ng pasyente mo, ano yung mga iba pang symptoms that your patient would feel? Let's talk about color. What do you think will happen to the color of the extremities? What will happen to the color of the extremities? Anybody? Mababa yung cardiac output. Yes, your patient would manifest with cyanosis. Kung hindi man cyanosis, your patient could be pale. Okay? How about the assessment where in class you press the nail beds? What do you call that? What do you call the assessment wherein you are pressing the nail beds? You are looking at the red color there, tapos pag press mo, naging maputi siya, and then chine-check mo kapag babalik siya ulit. What do you call that assessment? Very good. That will be your capillary refill time. We commonly refer to as your CRT. In this case, class, ano yung normal na CRT? How many seconds? Yung normal na CRT natin, students. What's the normal value of your CRT in terms of seconds? Pag-press nyo, try nyo. Pag-press nyo, class, di ba una-una pula yan. Pag-press mo, puputi. Pag-release mo, class, anong dapat mangyari? Dapat babalik siya sa pagkapula. Okay? You try to do that to yourselves. You press it first. Your nail beds are red, di ba? Your nail beds are red. So class, pag press mo niyan, it's expected to be white. Okay, it's expected to be white. By the time that you will release it, it will go back to red. How many seconds do you expect it to go back? It should go back very good. It should go back within 2 seconds. It should go back within 2 seconds. Now, pag decrease ang cardiac output ng pasyente natin, anong mangyayari sa capillary refill time ng pasyente natin? Will it be more than 2 seconds or will it be less than 2 seconds? Kasi mababa ang cardiac output ng patient natin. Yes, anybody? Yes, it would be more than 2 seconds. Okay? Now, in terms of nursing informatics, what am I teaching you here? Class, whatever you see in the monitor, as I would like to repeat again, you do not treat the monitor, you do not treat the equipment, you focus your attention on the patient. So if you saw in the monitor, oops, cardiac output 3 liters per minute. First time mo nakitang ganun, what would you do? Perform further assessments. If you do not know what's the next assessment that you will do, halimbawa, bagong nurse ka pa lang, hindi mo alam, anong gagawin ko dyan? Kay 3 liters per minute. Plus, isipin nyo lang na when you're learning health assessment, you will always be asked of the objective and the subjective cues. So mag-isip ka, anong objective? Anong titingnan ko sa katawan ng patient? Pag wala ka munang maisip, proceed ka kay subjective. Tanungin mo yung pasyente, ma'am, what are you feeling? Usually, the patient would complain dizziness. Usually, the patient would complain lightheadedness. Usually, class, the patient would complain shortness of breathing. Lahat ng complaints na yon is related to the decrease of the oxygen to other parts of the body. Bakit nag-lightheadedness? Kulang yung oxygen na pumupunta sa utak. Bakit nag-dizziness? Kulang oxygen papuntang utak. Bakit class nag-shortness of breathing? Kulang yung oxygen class na pumupunta sa lungs natin. Okay, that's why your patient are manifesting those signs and symptoms. So again, if you see in the machine, counter-check with your patient so that you will be able to know what's your patient really experiencing. Now, class, your machines could also evaluate the cardiac pump output and the volume status. As I have explained earlier, I have talked about cardiac output, so that is also your cardiac pump output. And class could also determine your volume status. Now, let's talk about one, I'm trying to remember a term. Okay, let's talk about class your, let's talk about one parameter. It's not on this cardiac monitor, but I want to discuss it to you. That would be your central venous pressure. Plus, we have what we refer to as your central venous pressure. Plus, when I talk about a central venous pressure, my dear students, your central venous pressure is like, it's a catheter now. It's measured using a catheter. We often refer to that as your CVP catheter. Okay? Let's see, CVP catheter. That CVP catheter class, look at the name. It says central venous pressure. So class, anong ginagawa? That very catheter is inserted to a major vein of our body, and then the end of the catheter is resting in our heart. That end class of the catheter would be resting, let's remove it, okay? Class, the end of the catheter would be resting in your right atrium. Okay, class, the end of the catheter would be resting at your right atrium. Why is it on the right atrium? If you can recall, class, right atrium, anong blood yung nire-receive niya? Oxygenated or deoxygenated? Pag sinabi kong right atrium, what blood does it receive? Does it receive your oxygenated or deoxygenated blood? Anybody, if you can recall your anatomy? Okay, so class, that will be in the right atrium, you have your deoxygenated blood. And guys, your deoxygenated blood travels through your veins. No? So nagta-travel siya through your veins. So class, pag gusto kong i-measure, tingnan niyo yung pangalan, central venous pressure. So ibig sabihin, class, I would want to measure the pressure on the central vein. And if you would look at it, the veins, class, that would enter your right atrium are your two biggest veins, which are your superior vena cava, and then you have your inferior vena cava. Okay? So, class, anong nangyayari dito sa CVP or central venous pressure monitoring? Class, if this is the catheter, which is of course inserted by the physician, this is your catheter here, which is inserted by the surgeon. So, class, ano pong nangyayari? At the end, class, of the catheter, there is a manometer that would be able to measure the pressure in the right atrium. Again, that catheter measures the pressure in the right atrium. Anong gagawin mo bilang nurse? Class, bilang nurse, you monitor that CVP. Your CVP, class, normally is between 5 to 10 millimeter mercury. Class, pag yung CVP natin bababa, halimbawa, the CVP is 2 millimeter mercury, one conclusion that I could get is that there is a decrease in the blood volume of my patient. There is a decrease in the blood volume of my patient. You don't actually need to memorize. If you will use your common sense, guys, pag maraming fluid dito, natural marami yung dugo natin. Pero class, once nag-decrease ang pressure dito, tapos lumiit lang yung pressure dito, class, that would mean that there's only a small amount of blood that passes through the right atrium. Ibig sabihin, class, nabawasan ang dugo ng pasyente natin. What could be the possible reason? It could be because of excessive bleeding, okay, referred to as hemorrhage. Halimbawa, class, na aksidente, tapos grabe yung pagdudugo. Another, class, is that it could also be caused by dehydration. It could also be caused by dehydration and many other causes. Okay? My main point here is that your values here could also measure the volume status of your patient. The values that we see in the cardiac monitor could also class measure the fluid status of the patient, which means that when I talk about fluid status, class, it's not all about intake and output. Okay? Intake and output are very important things. But please do not only think of intake and output. There are many ways to measure the fluid status or the volume status of your patient. Okay? Now, let's say, for example, if I would look at the BP of my patient, class, and the BP of my patient is 70/50. This is for an adult patient. Now, what can we say about the fluid status of the patient? What can we say about the fluid status of my patient? Sige na. Feeling nyo, increased or decreased? So class, if you would look at it, yes, it would indicate, class, that the fluid status of my patient is decreased. Very good. If you can recall, class, your lessons in fundamentals of nursing, you know that your BP is directly proportional. Your BP, class, is directly proportional to the fluid status of your patients. Okay? So as you can see, guys, we are learning technology, but this is all about the assessment of our patient, this time for your hemodynamic monitors. Now, let's look at this one. Our technology, class, also helps us to recognize patterns, such as your arrhythmia analysis and extract features. Guys, if I would look at an ECG, this might be too early to discuss deeper on ECG. So again, this is just an overview. Okay, I will just show to you the parts of an ECG so that you will be able to appreciate it. Plus, when I talk about ECG or your electrocardiogram, dear students, would have these parts, no? Or would have these waves. I'm sorry for the callers. So, class, the first wave here that you would see is what you refer to as your P wave. That is your P wave. Then class, this one is your Q, this one is your R, this one is your S. And then class, the wave here that would be present, let me see. Okay, class, the wave here that would be present is your T wave. Okay? So oftentimes, as you can see, expert nurses or nurses who are able to graduate already would usually refer to it as your PQRST. Okay, plus you will discuss deeper on that once you are in medical surgical nursing. But I would just would like to make a point here. If you would look at your class, no, you are looking at the different leads of the ECG. If you would look at the different leads of the ECG, you would need to have an in-depth training for you to be able to interpret it. Okay? Maraming training tayong dinadaanan. Pero what is technology doing to us? Plus, your technology is able to give us statements, and your technology is able to give us interpretation of the rhythm that the patient is having. Now, for example, look at this. May interpretation na siya, class. Sinus rhythm, left atrial enlargement, anteroseptal infarct, and age indeterminate. Okay? Tapos class, tingnan nyo to, nakalagay na abnormal ECG. Who is doing that interpretation? That interpretation class is done by the ECG machine. That interpretation class is done by the ECG machine. Eh sir, paano yan? Do we still verify that? Yes. Now, we still need to counter-check. And usually, the specialty of physicians that would be doing the counter-checking will be your cardiologist. Eh sir, para sa ano pa na may interpretation pero kina-counter-check naman? Class, so that there will be rapid response. There will be rapid response in case the condition of your patient would deteriorate. Okay? Now, look at that. Pag titingnan nyo yan, class, mini-measure actually yan. Tinitingnan kung gaano kalaki yung P-wave, gaano kahaba yung QRS complex, gaano kalaki yung T-wave. Tapos plus dyan dinidetermine kung ano pang problema ng pasyente natin. Plus when we are doing the counting, kung kami po yung nagka-count, binibilang po namin yung tinatawag naming big squares. These are the big squares. And plus dyan may mga lines pa yan dyan na hindi na masyadong obvious sa inyo. And these are your small squares class. We count that. We count that to determine how many seconds does one wave last. However, with your machine, automatic counting class is already established. And right away, we will be able to determine whether abnormal siya or hindi. Okay? Yes sir, bakit kailangan i-determine kung abnormal siya? Maliban class interested tayo sa mga abnormal, when you talk about your arrhythmia, my dear students, could also be life-threatening. Your arrhythmia could also be life-threatening. Okay? Plus, as of this time, you can think that if your heart goes lub-dub, if you have arrhythmia, your heart could go lub-dub-dub, lub-lub-lub, dub-dub, lub-lub-lub, dub-dub-dub. Okay? Abnormalities. Okay? Unlike the normal, which would be lub-dub, 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 your heart class would become abnormal if you have arrhythmias. So dapat early po nating ma-detect yan. It is, if I may say, it is somehow negligent on the part of the nurse not to recognize arrhythmia early because it would lead to the demise or death of our patients. So dito na naman yung reminder ko na kapag nag-a-alarm yung cardiac monitor, do not right away turn it off. You need to do your assessment. Okay? Now, next thing, recognize patterns, say still, and extract features. But here, you are looking into an AED. Class, ang nakikita niyo po sa screen niyo is ang tinatawag na AED. Plus, your AED is your automatic external defibrillator. Automatic external defibrillator. Now, class, let's talk about defibrillation. Pag sinabi kong defibrillation, nakita nyo sa movies, yung magsasabing mag-shock. Nakita nyo yung pag ganarn na may nagsashock, no? Kapag nakahiga yung pasyente, patay daw, magsashock. Okay? Now, class, your automatic external defibrillator is able to administer the shocks automatically. Plus, your defibrillation, as of this time, you can think of it as a shock. Okay, it's a bulk of electricity that is pushed towards your patient with the aim plus of restarting the heart. Now, your automatic external defibrillator class does it automatically. Okay? Ginagawa niya yan class automatically. Paano? Guys, one thing that we need to remember before answering that question is that not all rhythms, not all arrhythmias need shock. Okay? O, di ba sa nursing class, sa medical field, walang all eh. Pag sinabi niyang mahal ka niya all the time, hindi po yan truth, no? Kasi class sa nursing, walang all the time. Pag nakikita niyo sa board exam, usually magtatanong, all of the following are correct, except. So class, kung saan nagsasabi all, usually yan yung wrong. Okay? So class, pag sabihin ko sa inyo, all arrhythmias need shock, that's also wrong. Now, what do we mean by that? Plus, pag sinabi kong arrhythmia, halimbawa, class, ito yung normal ha. Pardon my drawing, it's not really medically accurate, but just to make the point. Halimbawa, class, this is the normal ECG. Okay, so if nakatanggap po kayo ng ECG tracing necklace during Valentine's, kindly make sure na normal siya, ha? Huwag kayong mag-wear kapag abnormal siya, okay? Bobong nagbigay niya. Sorry kung may natamaan. Anyway, plus if that is normal, this would be already considered abnormal. Tingnan nyo class na lumalayo yung space. That's considered abnormal. Okay? I'm trying to demonstrate here what we refer to as sinus bradycardia. You know in health assessment na kapag sinabi kong bradycardia, nag-slow down ang heart, di ba? Okay? Pagkatapos class, pag nagkaganito naman, that is considered also to be abnormal. I'm trying to differentiate, to demonstrate here sinus tachycardia. Ibig sabihin, napakabilis ng heart. Now class, pag ganito, ma-effort naman itong mag-drawing. Class, this wave here is also considered to be abnormal. Okay? The wave that I encircled in blue is also considered an abnormal. Dear students, that is referred to as your PVC. Premature ventricular contractions. Okay? Sarano yan. Later on sa medical surgical nursing, you will be able to understand that. Class, there is also a tracing that looks like this. No? Kung baga, nagdi-date kayo, tapos bigla na lang, nag-pause. Pagkatapos, nag-normal ulit. Okay? Class, we refer to this one as your sinus arrest. Okay? Natulalay lang siya siguro sa iyo na sobrang in love. Nag-pause for a moment. Okay? Now class, there are a lot of them. There are actually right now in my head, I can recall 15 type of arrhythmias. But the point is, not all of them needs shock. The very common error that you can see in movies is the flatline. Di ba class, pag flatline, yung usual na nakikita nyo, sasabihin, oy, let's do the shock. Class, that's actually wrong. A flatline based on research does not need shock. Okay? Your flatline does not need shock. It could actually aggravate their condition. Ang purpose po kasi ng shock is to convert the abnormal waves to the normal waves. Again, the purpose of your shock is to convert abnormal waves to normal waves. Sa flatline, anong wave ang nandyan? Wala. So what's the use of doing the shock? No? There is no wave to convert. So wala kang magagawa. Class, there are only two shockable rhythms. Ang tawag po natin dyan are two shockable rhythms. Okay? Now, one class is your pulseless VTAC. And then another one class is your ventricular fibrillation. You have your pulseless VTAC and then your ventricular fibrillation. Plus, with my drawing here, I hope parang na-realize nyo kung anong normal looks, no? Plus, si pulseless VTAC, ito po yung itsura. Okay? Oh, may P-wave kayong nakikita, may QRS kang nakikita, may T-wave kang nakikita, wala. Di mo alam kung saan dyan. Kasi it's very disorganized. And then plus your VFib looks like this one. Your VFib class looks like this one. Okay? So the same thing. You cannot see a P-wave. You cannot see a QRS complex. You cannot see a T-wave. These are your two shockable rhythms. Now imagine, nag-ambulance ka, no? Ambulance nurse ka, halimbawa. Tapos may nag-collapse daw sa barangay, malayo-layo, whatever barangay there. And then plus, you do not have an ECG. and then you need to respond to the patient. When you check the patient and there is no pulse and the patient is not breathing, one thing that you will do is to do CPR. And then if you have your AED, you need to attach your patient to this AED. Plus, kapag nasa ambulance ka, kapag ambulance nurse ka, ginagamit mo yung AED, hindi mo na kailangang mag-interpret nito. Hindi mo na kailangang magbilang. Ilan ang QRS complex? May P-wave ba akong nakikita? May QRS ba akong nakikita? You don't mind about that because the one that will interpret that for you is your defibrillator. Your AED class will be able to do the interpretation for you. Baka naman magtanong yung iba, sir, nasaan yung screen? Okay? Wala na class, wala kang screen na makikita in an automated external defibrillator because it is already the machine that will advise you whether the patient needs shock or not. So class, mag-a-attach yan. 2 pads lang yung ina-attach mo sa chest ng patient. Okay? Pakita ko sa inyo para hindi kayo nag-i-imagine. So class, pag sinabi kong AED pads, 2 lang po yan. Okay? Yan, that's how you place it on the patient's chest. Pagkatapos, class, sasabihan ka niyan, analyzing rhythm. Pag sinabi niyang analyzing rhythm, mag-pause ka muna ng CPR. Ano pong ginagawa natin yan? Gumaganyan po tayo to indicate that your hands off. Okay? Hindi, you're not touching the patient. Pagkatapos, class, sasabihin na ng AED, shock advised. Pag sinabi niya, class, na shock advised, ibig sabihin the rhythm is shockable. It's either VTAC or VFib. Pero pag sinabi ni AED, class, nagsasalita yung AED, ha, may speaker po yan. Ito po yung speaker. Kaya baka magtaka kayo, sir, nagsasalita. Oo, nagsasalita. Okay? Class, pag hindi naman advisable yung shock, ano pong sasabihin ng AED? Sasabihin lang, shock not advised. Proceed with CPR. Okay? So, kukontinue ka lang ng CPR. Pero kapag kailangan ng shock, sasabihin niya, shock advised. Stay clear of the patient. Tapos mag-charge yan, class. And then you just press a button once you would want to administer the shock. In this model, class, ito po yung button para sa shock. Okay? So, class, that's one beauty of technology, your automated external defibrillator. If you have been into airports, especially international airports, class, bawat siguro every 3, ano tawag yun ng haligi? Okay? Bawat ganun, class, may nakikitang AED na nakahang. Mga malls, class, abroad, may mga AED ka rin na nakahang. In the Philippine setting, I am aware that AED is required in big facilities. Pero usually, class, nakatago po yan. Tinatago nila sa main office. Kasi anong yung nangyayari, class? It's usually vandalized by other individuals. Okay? So supposedly, no, if you know how to operate an AED, it can actually save a life. It can actually save a life. Okay? So later on, pag makita nyo yan, for example, sa kung saan kayo sa abroad, you need to know what model is that so that you will be able to operate it effectively. Okay? May mga AED class na naka-number na yan. Number 1, tapos ang number 2 dito sa pads, tapos number 3 dito sa shock. Para kahit kahit hindi ka nurse, alam mo kung paano siya i-operate. No, para kahit hindi ka nurse or hindi ka medical practitioner, alam mo dapat kung paano siya i-operate. Okay? So students, I'm just sharing to you the technology referred to as your AED. Next, it also assesses your vascular system integrity. Okay? Class, what you're seeing on the screen is what you refer to as your scan. Okay? That is your duplex scan. Okay? Ano nga bang spelling ng duplex? Let me check. Let me check the spelling first. Baka mali yung spelling na ma-endorse ko sa inyo. Okay. So class duplex. So class duplex scan. There are 2 types. No? You have your venous scan and then you also have your arterial scan. Ano pong ginagawa niya? Diba in health assessment, you're being taught that your veins and your blood vessels should be patent. In this case, class, this technology is trying to determine the patency of your veins and your arteries. It determines the patency of your veins and arteries. Now, tingnan niyo po ito. What major blood vessel po can be seen on the neck? What major blood vessel can be seen on the neck?
Carotid, sir.
Okay, very good. That will be your carotid, no? Actually, class, this examination here is the examination of your carotid artery. Okay? Kung titingnan nyo, class, yung duplex scan na sinasabi ko, parang ultrasound lang siya. Okay? It's just like an ultrasound of your veins. It's just like an ultrasound of your artery. It's a non-invasive procedure. And from that, dear students, the doctor, the cardiologist, would try to determine the flow of the blood through the major blood vessels. Okay? Now, class, do not interpret that as, akala ko dati-rati, pag red artery, pag blue veins, no? Do not right away interpret it like that. Okay? In this case, class, since this is use of ultrasound, the newer technologies are already having the colors, no? Ano po yung purpose ng red? Yung red po would indicate that there is high pressure. The blue class would indicate that there is lower pressure. And oftentimes, true to that, red plus would be usually artery and blue would be usually referring to the veins. But that's not the case all the time. Huh? So class, it entails additional training. I don't have the technical ability to expound on this. But as a nurse, I am just looking into it as a non-invasive procedure that allows to determine class the patency of our blood vessels. Pag titingnan nyo yung blood vessels natin, halimbawa kasi carotid artery, tapos your patient class is usually complaining of dizziness, lightheadedness. One thing class na tinitingnan is that there could be fatty deposits on the carotid. Okay? May mga fats class na nag-deposit sa carotid. Pag may nag-deposit po na fats sa carotid, example, this is your carotid artery. Okay? Class, pag may nag-deposit na fats dito, makikita po nila yan, no? They will be able to see that in your duplex scan. And class, that condition is being referred to as your arteriosclerosis. Arteriosclerosis. Okay, the deposition of fatty products in the walls of your blood vessels. Eh sir, ano ngayon kung may nag-deposit na fats, eh di mataba ka. Okay, class, what would happen? The blood flow would be poor. Okay? The blood flow class would be poor. Okay? So, the doctor will be able to know, uy, yan yung problema. And the doctor will be able to suggest if what are the surgeries that needs to be done. If kailangan ng patient ng surgery, kailangan ng patient mag-diet, or kailangan ng patient ng medication in order to address the problem. Next, evaluate the patient's physiologic response to stimuli. Okay? Guys, this is a concept in your MCN. What do you call that test class wherein you will need to ring a bell or wherein you will need to use a vibrator towards the patient's abdomen to trigger fetal movement? What do you call that test? In your maternal and child nursing class, wherein in the old way class, they would ring a bell, or if not class, they would induce vibrations in the abdomen of the patient. What do you call that test? Sige na, anong tawag natin yan? What do you call the test that allows for stimulation of your fetus, of the baby's movement? Ultrasound? O hindi yung ultrasound. Plus, when I talk about ultrasound, your ultrasound is an imaging study. No? Ultrasound class is an imaging study. Right now, guys, what I'm asking you is that, what do you call the test that allows and monitors for the stimulation of the fetus? Sabi ko nga, nagri-ring a bell or if not class, vibrations. Sige na. 3 letters yan. Nagsisimula sa N. Sige, 2 letters na lang. Acronym siya. Okay, very good. You're referring to your non-stress test. Okay, class, so you have what you refer to as your non-stress test. Oh, class, nurses do the non-stress test. Nurses assist in the non-stress test. We can also do non-stress test depending on the policy of your hospital. So ano pong ginagawa natin sa non-stress test? Class, your patient is being attached to a monitor. That monitor class would be able to monitor 2 things. That would be your fetal movement, that will be your fetal heart rate, and then plus your fetal movement or uterine contractions. Okay, so class yung 2 things fetal heart rate po yung isa, Pagkatapos pangalawa, yung movement or uterine contractions. Now, what do we expect? Class, if we are placing our patients on this monitor, we expect the results to be reactive. We expect the results to be reactive. In other words, dear students, pag nagmo-move si fetus, what would you expect? When the fetus class is moving, what would you expect with the heart rate? Will the heart rate increase or will the heart rate decrease? What would you expect class with the heart rate? Will it increase or will it decrease? Gumagalaw si fetus, anong mangyayari class? You would expect the heart rate to increase. That's why the normal finding for this one is reactive siya dapat. Okay? Reactive siya dapat. So minsan sasabihin sa area, oy, natutulog si fetus. Anong gagawin? Nire-ring a bell. If hindi po gagana yung ring a bell class, yung ginagawa is binavibrate. No? Binavibrate. Okay? May vibration, may vibrator po na ginagamit in the clinical setting. It's a vibrator that is used for the abdomen and not for any other purposes. Ha? Baka kung ano-anong iniisip ninyo. Now class, this is an example of your non-stress test. As you can see here, dear students, you can see that this is fetal movement. Okay, nakikita po ninyo, yan po yung mga fetal movement. And then class, as you can see here, there is an increase in the heart rate. There is an increase in the heart rate of the baby, which would indicate that the baby is indeed reactive. Okay? Now, tingnan pa po natin itong isa. Okay? Dito po, ito po yung movement. Tapos dito po natin nakikita yung reaction ni baby. Nakita nyo class na pag-move dito, class, there are changes here on the vital signs that would indicate that the heart rate is increasing. Can you see that? Can you see what I'm referring to? Nakikita nyo? Okay? So class, why am I showing you these images? Because in the clinical setting, if you are the ones who will get that strip, you need to scan it right away. So that if you will see something like this, look at this class. Nag-move daw si baby dito. Nag-contract yung uterus dito. Pagkatapos, look at the heart rate. As is. Which means, class, that the baby is non-reactive. Okay? O, anong gagawin pag non-reactive si baby? Inform the doctor right away. Why? What might be happening? Baka, class, may cord coil. Okay, baka may cord coil. Or baka class, it's also possible that your baby is experiencing something fatal inside the abdomen, inside the uterus class, that is already endangering his or her life. Okay, so immediate action needs to be done. So again, class, when I talk about non-stress test, what do you expect to be the normal result? Reactive or non-reactive? Sige na, ano yung normal result class when we are talking about your non-stress test? Okay, very good. So class, the normal finding there is that it should be reactive. Again, abnormal po pag non-reactive. And class, once there is movement, what should be the normal finding in your non-stress test? Will it be the increase of your heart rate or will it be the decrease of your fetal heart rate? Anong mangyayari class once there is movement? There is increase of your heart rate. Okay? Now again, students, technology that is helping us to assess our patients. And then another thing is that it allows us to continuously assess our respiratory gases. One example, class, is what you refer to as your capnography. Your capnography, dear students, monitors your carbon dioxide levels. Your capnography monitors your carbon dioxide levels. Because the partial pressure of carbon dioxide in our body should only range from 35 to 45 millimeter mercury. If the carbon dioxide class would be higher than that, meaning my patient is experiencing a problem. Lower than that, my patient also experiences a problem. So if you would look at the cardiac monitor, dear students, dito po natin makikita yung ating partial pressure, okay, or your estimated carbon dioxide. So that is what you refer to as your capnography. Okay? So again ha, kung nakikita ninyo, maraming models ng cardiac monitor, okay, that you could encounter in your setting. That's why one important thing also is that you need to ensure that you will be oriented also on the specific cardiac monitor that you are using. Okay? So these are some of the technologies, no, being used in the hospital setting.